Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on the physicians and practitioners who are redefining medicine through their integrative, functional, and holistic approach to health and well-being.
We are pleased to welcome Dr. Andrew Greenland, an integrative functional medicine physician practicing in Twickenham, London. Welcome.
That's right. Thank you.
So I understand you are a naturopath and a medical herbalist.
I'm actually, I still have a job, I still have a day job. I'm still an emergency physician, but I've also trained as a naturopath, herbalist, functional medicine. I've also done osteopathy in my past as well, so I've got a really mixed bag of tools that I use for my practice.
Oh, okay. So let's talk about that a little bit. When you came out of med school and started practicing, you went into emergency?
Yes, so I had to go through the training route, and along my way I was sort of thinking there are other things that I've always been interested in doing, and I wanted to do something other than just the day job working in the sharp end of medicine. So right. I've developed all these other interests on the side, and they've all kind of amassed together over the years.
I would imagine you saw a lot of conditions in emergency medicine that you felt as though if you had the opportunity to intervene earlier, perhaps they wouldn't have ended up in the emergency room.
Yeah, I mean, we're basically seeing, in that setting, we're seeing first aid. We're basically doing first aid, so people have literally reached a critical mass in their illness. Right. And you think, well, yes, we could have done a lot of preventative work for these people further down the line. Right. We're just seeing them at the end of their tether when things have just reached that critical point.
Right. So for the people who are not familiar with a naturopath, tell us a little bit about the study of naturopathic medicine.
So naturopathic medicine is using natural therapies to treat disease. So rather than using drugs and surgery, which is what we do in conventional medicine, we're looking at diet and lifestyle and herbal medicine. Some people who have an interest in homeopathy will use homeopathy. Those kind of therapies, so very much sort of natural-based things that we can do other than writing a prescription pad or using a knife.
I would imagine a medical herbalist is a nice tie-in to naturopath. Can you tell us what you do as a medical herbalist?
So yes, it's a nice tie-in, and the medical herbalism is part of naturopathy. It's one of the branches of naturopathy. So I did naturopathy, which is a very general sort of training, and then I specialised in herbal medicine. I sort of went in that direction. Mm-hmm. And it's nice because it's basically, you have a whole repertoire of things that you can use in the same way we have drugs that we use in medicine, we have herbs that we can use in naturopathy. Mm-hmm. But it's rather nice that you can combine herbs, and there's a real skill in combining herbs and using them for particular problems. Right. So it's rather than just looking, a little white pill for something, we can actually be quite creative. Yeah.
So give us an example, like if somebody comes in and sees you and they're having trouble sleeping, and you kind of get to know them a little bit better, and you feel as though they're suffering from some anxiety and things like that, as opposed to giving them a prescription, you might approach that situation with herbs.
Yeah, although actually we use some basic sleep hygiene things as part of their treatment as well. So fixing a lot of the things that people don't think about, what they're doing in the evening and when they're eating, and are they eating too late? Are they having caffeine and alcohol? Right. Have they got a horrible sleep environment which has got lots of electromagnetic radiation things around? Yeah, right. And then herbs would be one of the strands that we would use for that. Yeah. Things that help you to get off to sleep, stay asleep, and to keep you relaxed and along the way.
Yeah. So many people fall asleep with the TV on.
Exactly.
Yeah, not a good idea.
Well, there's many reasons. One is the content that you're actually getting through, which is actually keeping your brain working overtime trying to process all this content, but also the blue light that we get off the screens as well is actually quite disruptive to sleep.
Yeah, yeah. And fortunately, I think as a culture, society, we're starting to appreciate sleep more, because there's been a lot of studies out that show that it's obviously very important, but your brain detoxifies when you sleep and things like that. So people are taking
you're right. Sleep is massively important and much neglected. It all sounds a bit fluffy when we talk about it, but we do know that people that chronically get 7 hours of sleep or less over a long period of time are at much higher risk of cancer, Alzheimer's, and a lot of the chronic diseases of our time. Yeah. So it's hugely important. And I do spend a lot of time delving into patients' sleep, and nobody's ever asked these questions before, until I get to them.
Right. So you still practice emergency medicine, and you've got your functional medicine practice as a as a second practice?
Yes, so my main day job is the emergency medicine, but then I do need something a bit more chilled and something where I've got the time to spend with people, because you do need time to sit down and unpick people's very complicated medical problems.
Right.
So that's a very separate thing. And the other thing is that they don't really mix terribly well. I'm really dealing with a sharp end in medicine where people are, acutely unwell and need emergency treatment, whereas functional medicine is something which takes a little bit more time and energy to spend to try and fix their problems.
Right.
So it's a nice contrast.
I was on your website and I saw that you have incorporated the Bredesen Protocol. Can you tell us what that is?
Yeah, so the Bredesen Protocol is a very new, promising program for patients with Alzheimer's disease, cognitive decline, dementia. And it's a very holistic dietary and lifestyle approach to trying to at least halt this problem, which is a massive epidemic across the world. And for some people, we're even managing to reverse that disease, which is hugely promising and exciting. Bearing in mind, we've always been told that actually, no, this is it. And once you've got Alzheimer's, it's a steady decline. We're actually seeing real green shoots of people reversing their disease process using this approach.
And so what is the approach? Can you give us an outline?
So it's basically very good applied functional medicine. It's really looking at the diet and trying to clean up the diet and making sure people are sleeping properly and making sure they're not stressed. Trying to get them off a lot of the medicines which we know are dementogens. So we know that, for instance, statins that a lot of people are on for their cholesterol are drugs which can contribute to dementia, for instance. So we're literally really cleaning up all aspects of their life with the aim of trying to turn around their disease.
Oh, okay. And what kind of a process is it? Is it over the course of months, or obviously it becomes a lifestyle, right?
So there's quite a big workup. So we do a massive diagnostic workup, a clinical assessment, MRI scan. We then try and create a bespoke, personalised plan for that patient, which will be looking at all those particular things that we've found in the labs, their lifestyle and everything else, and then we'll give them a program of a clean-up operation, which will include some supplements as well. And we're sort of saying it takes around 3 to 6 months to start seeing some results, if people do it properly.
Right. I'm wondering, we have an election coming up in 2020, as you may be aware, and one of the big issues is universal health care, Medicare for all. It's a major concern, the expense of insurance, the expense of medical care, and having insurance run as a middleman and tell physicians like yourself what will and will not be covered, basically telling you how to practice medicine. You don't have those issues in England, do you?
We don't, because we have the National Health Service,
right,
which is free at the point of delivery for patients. But the kind of things that I'm doing are outside of that box. And so this is all having to be funded privately by patients and their families.
Oh, okay. I was wondering. So, and is there a movement underfoot to get, the type of medicine that you practice, covered under the national policy, or no?
There's a great appetite for it, but it's about gathering evidence, and it's a very hard thing to gather evidence for, because we change so many things in the work that we do. In conventional medicine, if you've got a new drug to trial, you compare drug A with drug B, or drug A versus placebo. In functional medicine and this kind of work, we're changing their diet and their lifestyle, we're putting on supplements, we're sorting out their sleep. So it's actually quite hard to gather evidence for our mainstream doctors who are looking at the double-blind randomized control trial as their robust piece of evidence.
Yeah, right.
But it'd be wonderful if we can move in that direction, because this is great preventative work. Doing a lot of this stuff in advance of people developing these chronic illnesses will ultimately save huge amounts of money for the economy and for the health system.
Yeah, and all of that, just the misery that comes along with being sick and tired. Yeah, absolutely. And we're hoping that we can continue to move in that direction. Organizations like FRCEM are influential as well. So you're over here from London, here being the FRCEM conference in LA at the beautiful Terranea Resort. What brought you over here? What workshops or what are you studying here at this conference?
So I'm doing a module at the moment which is on mitochondrial restoration. This is one of their advanced modules, and having done a functional medicine already with the IFM, this is like a natural progression for me. It's like the next step. Right. It's really taking functional medicine and it's taking it up a gear. it's putting a very useful anti-aging spin on a lot of the knowledge I'm learning, but also learning lots of new things, bring me up to date with new things. But that's the module I'm doing at the moment. I've got a few more planned over the course of the year.
Well, what kind of topics have they covered over the last couple of days?
So a lot of the things, mitochondrial disease now seems to be the cornerstone of many chronic illnesses. So chronic fatigue and Lyme disease and SIRS and biotoxin illness and mold have all got elements of mitochondrial disease in them, and it's actually quite nice to see this sort of separated out, and we can try and tackle this as a topic in its own right, because it really is now proving to be the kind of a panacea in terms of there seems to be some dysfunction in mitochondria and so many problems.
Mm-hmm. Have you done other workshops or other modules with FRCEM?
So I've done the endocrinology module. I've done their bioidentical hormone replacement therapy, and it's nice to find new things to do. And I'm an eternal student, I admit it. I'm always looking for new things to learn and expand my practice and expand my knowledge and understanding. Mm-hmm. So there's plenty of material here to keep me going.
Have you incorporated BHRT into your practice?
A little bit, yes. So even with my Alzheimer's work, we're finding a lot of the patients, their hormonal axis is off. So being able to actually add in hormones appropriately is a really useful strand to what I'm doing with that work.
And are you interested in the peptides?
I am very interested. I would love to find out more, but unfortunately in the UK we don't have access to them, or there's a regulatory problem. So much as I would like to come and learn about them here, if I can't practice them in the UK or have access to them in the UK, I'm going to have a problem. Yeah. So I'm waiting, hopefully there'll be enough of a movement and we'll start being able to have access to these new exciting forms of treatment. Right. And then I will take up the gauntlet and learn about them.
How would you compare the UK and the United States in terms of how progressive, I guess, lack of a better word, they are in functional integrative approaches?
I think the US are much more progressive in these things because the whole functional medicine movement has really come from the States. Mm-hmm. So they're more progressive in the sense of they were born here and it's taking a long time for them to cross over to the UK. Right. So the movement is growing, but it's much slower. And we don't have the momentum and the gravity that the US does because all of the people who have founded and developed the work are US-centric. Mm-hmm.
And what about your patient population? Are they seeking this out? Are they coming to you because they've already learned a bit about it? Or is there a lot of patient education involved in your treatment?
Patients are seeking this stuff out, and I know one of the other functional medicine organisations say they're getting about 1 million hits a year looking for practitioners. Wow. So we know that patients have heard about it, and we know that they're desperately seeking practitioners, and we are in short supply. There's more work than we can possibly handle, and it's not getting any easier.
Yeah. One last question. You kind of straddle both sides with your emergency care medicine being the more traditional side, and then of course naturopath and herbalist. Have you gotten any pushback or sideways glances from your peers about what you do, or are they accepting and curious?
I think they're probably quite ignorant in the sense they don't really understand what I do. I don't really mention a huge amount about it in the day job because I can't frankly be bothered to argue and explain and try and justify what I do if they're uninitiated. Right. Yeah. So I think they probably would balk at some of the things that I do.
Yeah. Yeah. Well, certainly you have a friendly community here within FRCEM to network with and be a part of. So we're thrilled that you're here, and thank you for taking the time to join us here for Redefining Medicine.
Thank you.